Mr. Chairman and Supervisors, I'll take that first. The authority now legally, and Corporation Counsel Dawn can supplement this comment, is with the local health officer. So Commissioner Kowalik has the authority now, and the state statute is 252, and the subchapters within that Wisconsin statute are very robust, and they have very, very, very broad authority. And that, in so much as they can issue quarantine orders, they can give police powers to any health officer or coordinator that is staffed under them, and that applies to even, say, the city of Greenfield. They can empower their health officer staff to be have police powers and be quarantine guards. That being said, I am very confident that here locally we would do everything we could to keep the current measures we have in place, because it is proven that once you open your borders, looking at the islands of Singapore and Taiwan, is that the virus did come back and they had a second wave or spread of the virus. And their confirmed cases continue to climb, as well as their fatalities. So I imagine that the health officers would band together, and here we do have a strong unity among the 11 health officers, depending on how that federal order came down. But that is definitely not the feeling among those that have the power here locally.
Hi, this is Corporation Counsel Dawn. I can just react very briefly to that. From a very high-level perspective, as to these questions of what occurs in Milwaukee County in the state of Wisconsin with respect to the continuation of a declared state of emergency, the federal government has literally no control. The governor's declared state of emergency must be reviewed and ratified and/or extended by the state legislature by May 10th. Of course, the governor's orders related to that declared state of emergency apply to Milwaukee County and our subject municipalities, as well as statewide. As to Milwaukee County, even if the state emergency declaration were to expire, the emergency declaration by the county executive and supported by the health officers, as Christina's noted under the unified EOC, would continue to have effect and be required to be followed within the county. So there, as you can see, there are various levels, but the frank reality is that the commander-in-chief has very little to no influence and control. He has influence, but he does not have legally a direct line of authority to command governors or local chief executives or local health officials to declare the emergency over.
But in the situation of our airport, and if he declares that air travel has to be permitted and he wants people flying again, I would think that we could have another wave of people infected with COVID-19 coming through our airports. Do we have any say over our airports then?
I would have to respectfully, Chairman and Supervisors, look very critically at the particular regulatory structures. I can say this: there are broad authorities that inure locally within our own sheriff's department with respect to public health and safety. The airport falls within the jurisdictional bounds of the county. Again, we have a coordinated unified EOC. We have health officers. So even if there weren't federally mandated restrictions on air travel implemented through the Federal Aviation Administration, we would still have a number of powers locally to try to address passenger flow and try to protect the health and safety of passengers passing through Mitchell International Airport.
Well, thank you very much.